button. Okay, so hello everyone. Welcome at our collective learning event. It has quite long title, Empowering Early Years Collaborative Project Enhancing Early Childhood Development in Czechia, Slovakia and Hungary. We are so happy to have you here. And I'm Teresa, I'm a project manager / assistant, and I'm going to moderate this event with help of Christina, who is our communication manager, and some help from Dia, our project manager. We are Places to Grow, so I will just give a brief introduction about our project, our program. Places to Grow is a program which is based in those 3 countries. It's a catalyst for excellence in early childhood development, education, and care. And as you may know or don't know, the program aims to strengthen connections between organizations which are engaged in social services, education, advocacy, and all kinds of research. And just to sum it up or give you an idea what our mission is to foster a collaborative community driven by a shared vision to assist every child in realizing their potential to contribute to our society. So that's Places to Grow. And today specifically, we are going to speak about and present some projects from our Joint Action Fund, which is our grant scheme. And today you could hear stories from our 4 grantees. That grant scheme fosters innovation, learning, and cross-sectoral collaboration, which is aiming for systemic change in those 3 countries. It's something like a flagship initiative. It's designed to strengthen collaboration among our partners, but also other relevant stakeholders. And the part of Joint Action Fund, it's not only a financial support, but also non-financial, which incorporates knowledge sharing and community, knowledge sharing between the community of practice. I would like to share with you an agenda, so we will be all on the same page. After the introduction, we had to reshift the program a little bit, so we will start with the with a short presentation from Kateřina about local incubators of early childhood development in Czechia, and then there will continue another 3 presentations. After each presentation, there will be time for Q&A, so feel free to either raise your hand or write in the chat your questions. And afterwards, there's going to be even more time for questions, so we will divide into breakout rooms, and you could then dig deeper into those specific projects and topics. Yeah, so that's it from my side. I hope it's all clear. If not, feel free to ask in the chat. And I will already ask Kateřina to start her presentation about their project in Czechia.
Okay, thank you. I will share my screen. And I can't speak and do something simultaneously. So, hello everyone. My name is Kateřina. I work for an umbrella organization here in Czech Republic. Our name is Platforma pro včasnou péči. The short translation is the ECD network or platform. As I said, we are an umbrella organization, and we are gathering around 50 members, mostly social services, smaller, bigger ones, but also kindergartens and other body. And what was the story behind all this? Basically, we were founded, or we started to do the networking 3 years ago, and since the real beginning, we promoted or supported financially also um, around 20 organization in their actual work in the field. And what we seen, it was quite clear that there are so many active people in the country with great experience, activities, but with, let's say, very limited communications towards the decision makers and politicians. So basically, then the impact was not enough, or not enough for the way what we needed or they needed. So basically, what we did was that we opened a call for those who wanted to do more, and we picked up 4 cities, and we offered them support of facilitators, one for especially advocacy work, advocacy expert, and one for, let's say, coaching or facilitation itself. And those cities are Znojmo, Plzeň, you probably know that for beer reason, Chrudim, a Vítkov, which is the smallest one. And at the beginning, we had 3, let's say, rules that the most important part for any collaboration is to have enough time and capacities for that. It's not rocket science, right? But this is crucial. If you want to go further, you have to have enough time and enough energy, and do it regularly. That's the way. The second rule was that the activities or it can't be made despite the politicians or against them. So that was quite challenging, for example, in Plzeň, where for a very long time the practitioners didn't have access to those who were at the decision, were the most powerful, let's say, because there were no common values. Let's put it this way. But through the, let's say, support and advocacy support, we found a way how to enter this point, even though. And the third point rule is clear aims and planning. That's also very clear. And from our point of view, the powerful moment is really to combine experts and political will together. And we know that systems which are functioning this way are much better than without the politicians and without the decision makers. And from the beginning, we were searching for a model or for some tool, evidence-based tool, which could help us. And we found Primokis, which is evidence-based program process held by the International Step-by-Step Association, ISA. And we asked for, the license. And that was also the very important part of this project. And just shortly, what Primokis is, it's what's the most important is that it's a process. It's not a project. It's a process-based program meant for municipalities, no practitioners, even though the practitioners are important part or they are involved. And this process is based on capacity building for municipalities, and it comes with 7 phases, which brings the importance of early years to the municipality, to the families, to the practitioners, and all the people or all the professionals who are belonging to the municipality. That's very it's a very shortcut, but I think for the time of being, it's enough. And what we have learned so far, and I have to say that now we have September, so we've got 9 months running, and some of the months are still ahead of us. So what we've learned so far that um, it's very important not only the way how we understand, for example, the importance of early years or that we need to collaborate or we need to go cross-sectoral. It's not enough. The point is how we communicate that, and what's the marketing and the communication behind that, or how we are able to explain it to those who we want to listen or to buy in. Uh, uh, the part of the project from the beginning was that we wanted to organize a study visit, and the topic was Primokis again. We went to Hungary for a study visit to be able to talk to mayors and others who already implemented. And we took 4 people from each of the supported region. And the most important part that we took the politicians, and to spend 3 days all together was very fruitful because there was time to have deep discussions, to see their perspective, to learn more about their needs, to see them in a different light, let's say. And this study visit was in spring at the beginning, because we knew that this gonna be the opening, the entering point for further cooperation. And this definitely was something what uh, uh, what we learned, that this is always something what works, basically, because the first step or the first good step is to start working on relationships, and then to build the collaboration next to it. So that was clear. And also what we've learned, that some of the outcomes definitely came from unexpected corners. Connections, ideas. So there are always outcomes, sometimes very light or not seen as a most important at the beginning, but step by step they are starting to be keys. One example, for the Primo case, we made 2 workshops because we need to raise to gain the know-how from ISA, and we invited for those workshops also other let's say, important stakeholders here in Czech, people from the ministries, from other umbrella organizations, NGOs, from different fields. And that was something what really started another collaboration and very fruitful outcomes much farther. Yeah. What I like, or I pick up one sentence from Michaela Ionescu, the program director of ISA, because she was talking about that sometimes we expect quite a lot from the others or from our projects, but the point is that the success is always different in different cities, different regions, and what we should aim at is that the people who we want to work with are afterwards they learn more, or they learn something they didn't know before, and that's the point. And sometimes they learn maybe from our perspective not too much, but it's not sorry. The measurement is not probably the right. I pick up some pictures from the gatherings. Basically, we except the study visit, there were just so many meetings and events, but nothing really too much photogenic because there are just people talking and yeah. So uh, mm, I missed some of the examples because I wanted to add that something very practical, and I skip it. Sorry. So I want to add just some specific example that a year ago, for example, in one of the cities, that was the NGO who was pushing all the schools and all the kindergartens to enter to a program, which is a state program, and basically it provides lunches for free for all kids. And they put so much energy to persuade all the schools to enter to this program. But it was very they made it, but the other year they should start it again, actually, with this lobbying. And what the study visit made was that the decision maker or the member of the council of the city just really he caught the point, and he was the one who started to be the leader, or he just sent one email to all the schools with simple question. This is something what we need you to accept. If not, please send me the answer why you are not accepting the program lunches for free. So it cost one email, and in the previous year, the NGO spent much more energy and time, and the outcome was the same. So that's one example for all. Sorry. Yeah, I'm done. Thank you.
Thank you, Katarzyna. I really love the rules. Like, they are so simple, and maybe I'll start with a quick question about the rules itself. Like, Can you imagine, or are you using them already in your different projects or even in your organization?
I think through this year, I realized that it's even more important because, you know, in every project application, you have to always prove that you have enough time for what you are saying. But the paper and the reality is sometimes different. So what I learn is that uh, I have to maybe ask different questions to be sure.
Yes, totally. Do you have any questions, or what are the questions from the others?
Hi, can I ask a question? It's Veronica from
Sure.
Karpatin Foundation in Slovakia. And I'm sorry, I cannot see for some reason the option to raise hand in Zoom, so that's why I just jump in. So hi, Katka, and thank you for a really interesting presentation. I was just wondering exactly about this rule. I really like it, that especially the first point, that you should have the time that it requires, especially for this kind of partnership. So I was just wondering, what was the capacity of your team? It was sort of 4 locations, for municipalities, stakeholders you were working with, like, what was the team working on it? So that's the first question. And the second question was exactly about some sort of, I know maybe it's early on, but like if there were any other sort of tangible results on the side of municipalities in terms of maybe creating some new services or redesigning these existing services, or if that's something that you feel requires more time to get to such point.
Thank you, Veronica, for your questions. The time, actually, the facilitators, they have regular meetings with each of the municipalities. So we do. So actually, it's hard to say because each of it wasn't, you know, sometimes it cost us more hours and sometimes less. So it could be like 0, 1, 0, 2 in some cases, in some period of time. And the second part of your question, yeah, that I didn't want to go in too much detail because each city had different, you know, they had different aims and different ways how to achieve that. So, for example, Plzeň, as I said, there were probably no way how to reach the most important people in the city council or in the so their way was to buy in the others, for example, the Czech school inspection and stuff. So I want to be more specific. They were trying to solve the problem that kindergartens in all the city, which is a city around 60,000 people, that all the kindergartens were asking for very long list of items for parents when they wanted to enter. When the kid started to going to the kindergarten, they had to buy a really incredible long list of things. And this was a huge barrier for, obviously, the parents with low income, and they basically choose not to subscribe their kid to the kindergarten. That was the problem. The mayor or the person responsible for the school education didn't see any problem in that. So what the people in Plzeň did, that they used PR push, let's say, and they use other people who could make the push the people responsible for that. That was one example. And for example, in Znojmo, they started new services last year. It's very new, and they didn't have any support, financial support. So their aim was to become sustainable, but furthermore to bring the topic of the early years in the city itself. So their way how to do it was different. They started to organize roundtables. In a few weeks, they will have a conference, and they, step by step, started to create new collaboration in the city for the first time.
Wow, that's great. Sounds very good. Yeah, okay. If the others has questions for Katarzyna, then maybe wait with them, and you can ask them in the breakout rooms, as we are a little bit behind the time. But Yvette, I remember that you had the question, so maybe you can.
Yes, but I can, if you want to keep the schedule, I can ask it in the breakout room if that's...
Yeah, that would be
Thank
great.
you.
Yeah, so just remember it. Thanks. And also, Veronica, yeah, they changed a bit the design of Zoom, but when you press on the React, where there is the heart logo, there is a raise hand, just for everyone. Okay, great. So thank you so much, Katarzyna. It was very interesting. And we can move on with Shoshana's presentation about the project of organization Cesta Von.
Yes, thank you very much. Just 1 second. Okay. Okay, thank you. And hello and good morning to all of you. So our project has a pretty long name towards improved quality of Omama and the subsequent ECD social service. The project has two parts. The first one is evaluation of the Omama project, and the second one is advocacy for establishing the early childhood education and care service in Slovak legislature. In the evaluation part, our goal was to harness the knowledge of the 7 years of Omama program, where we wanted to look at what works and what might not work in our project, then harness that knowledge, gain some future direction for Omama program, but also for maybe establishing the quality framework that could be then later on used when establishing similar service in the Slovak law. And then in the advocacy part, using not just that knowledge, but maybe also knowledge of the other organizations with similar activities, and get it into get that service into the law, and also get the funding for it from the law. Okay. In the spirit of Places to Grow, we cooperate on our project with two Places to Grow partners, Skola and Perica being the one who is doing the evaluation for us, so being the external evaluator, but in very close collaboration with our analytical team at Cesta Von, and then Socia being the partner for the advocacy part. But we also very closely work with the new upcoming and emerging Slovak platform for early childhood development called Odperinky. So what has been done, where we're at? So first I wanted to show you just a little bit what kind of data we have collected, because in evaluation all of the data has been collected, and now we're waiting for the results and for the analysis to be finalized by Škola Empirica. So we have decided, in order to triangulate the data on the evaluation and get as many sources of data to get as relevant of results or as valid of results as possible. So we triangulated the data from, let's say, 3 sources. The first sources being our internal team of Cesta. So first, Škola Empirica has conducted expert interviews with the project team, the project management, and then with the local coordinators or regional coordinators of the program. And then they did focus groups with Omamas, mentors, and supervisors. Also, some Omamas that have already left the program. So as we could see, like, what are some of the reasons why Omamas leave the programs. Second source of data were the people involved, our clients. So we conducted questionnaires with parents of children who are currently in the program, parents of our alumni, also parents that dropped out of the program, as to find out why did they drop out, and also children not involved in the program to gain some sort of like control group for the results. We have also decided to gain perspective of our alumni, of the children in the program. So we have used some art-based methods with the children. And lastly, we collected we have a lot of data in the Omama app that is being collected throughout the entire existence of Omama programs. So some of the analyses are done from our app. I don't have very many pictures because, as Katarina said, the meetings are not the most photogenic, but what was quite photogenic was the data collection with our clients. So here you can see our data collectors, our questionnaire administrators being in the field, doing the questionnaires with the families. This was mostly done on the street, outside of the houses, inside of their houses, or in community centers, or some other places where Omama lessons take place. And the pictures you can see, those are the pictures collected during the art-based methods. So those are the pictures drawn by our alumni. The prompt was draw what you remember from Omama lessons. So in the bottom left, you can see a lot of the toys and the books used in the lessons. On the top left corner of the bottom left picture, you can see this is me when I grow up. I want to have big muscles, so I just included this picture because it's my favorite one. Then on the middle top picture, you can see there are quite a lot of people on that picture, and that is because there was a lot of family members present during the lessons because it was in the household. So those are all the other children in there. Oh, sorry, I don't know what happened. And then in the bottom one, there are also some like, oh, I remember this song called Shasho. This was my favorite song. So the alumni, and they had also very nice things to say about the program and what they remember. In the advocacy part, there are 3 main goals, or I grouped them into three pieces. So first, there are all the meetings with group and the working groups at ministries, with officials, with politicians and other institutions. Second goal is drafting an ideal model of the service together with sources of funding and also examples from some other countries on how the model for such service could look. And third goal is creating a campaign that would also raise awareness about the necessity of early childhood education and care services and support in early childhood. So at the moment, all the data have been collected and are being analyzed. And regarding the advocacy, together with Socia and together with the partners at the platform, we have created the proposed wording of the new law, also with the justification for the new law. And that has made it, at least the justification made it into a new conceptual document at the Ministry of Social Affairs. So that's one tiny step, but we're getting there. But this is basically where we're at. But there are some challenges we're facing, and these regard mostly the data. Since there's, as I said, we collect a lot of data at Cesta, but we struggle with having a comparison group because even if we collect something that is being collected on a national level, what lacks is the disaggregation of the national data. So we cannot really tell that these children are from comparable group. We can just say like, this is the general population. So of course, Omama kids being from very socially excluded population lag behind. We cannot say like, okay, compared to similar children, they're doing better because we cannot really identify those similar children in the national data. And we see from some of the preliminary results that the screening that is being used nationally is discriminating based on socioeconomic status and ethnicity, it seems. So this is something we were afraid of, but now we have it confirmed. The other challenge is the delay that comes with the results, and also the uncertainty of when we have final results and how interpretable they will be. Another challenge is the social desirability of the parents that are either dropped out of the program or that have never been included because they did not answer maybe as openly or as truthfully as the children, as the parents of the children who have been in the program or are currently in the program and they have trust towards us. Another challenges that come with the advocacy have been the personal changes at the Ministry of Social Affairs. So some of the previously established contact has now been gone, and now we need to kind of try to get contact and build relationships with new government officials. We also need to get the public support because that's what creates the political support or political pressure. And also another challenge is regarding the funding, as there is quite a big uncertainty with how the public finances are going to look in Slovakia and whether we'll be able to get financial support for this service. So what remains to be done or what's ahead of us? So after we get the final results, we need to disseminate them and formulate some recommendations for the quality framework for the service, but also the future direction of Omama. We need to finalize the ideal model of what the service could look like and how it could be funded. And we need to get the political and the public support for these changes we're advocating for. And lastly, we need to draft the educational program or the educational framework for how to share the know-how we already have or other organizations that have been doing similar work. And that's all for me. Thank you very much. I've taken way more time than I was supposed to, but hopefully went through it all.
Yes, thank you so much, Shoshana. That was very interesting. Again, I really love that art-based research. We were speaking about it before, but I really love that children use whole paper, you know, like it means that they have lots of memories, I would say. And thank you so much also for such frank sharing of the challenges, because yeah, we are living challenging times. Let's put it this way. Okay, do we have any questions for Shoshana? You can either raise your hand, write it in the chat, or just jump into it. Christina, no?
Good morning. Thank you, Shoshana. That was a great presentation and really nice to hear from you. I do have a question for you. I'm sort of curious how your learnings from this particular project have sort of impacted how you may think about approaching future projects.
Yeah, I think we have learned quite a lot along the way. For me, what this has, how it has framed my thinking about the future is really thinking, but I have not reached the conclusion yet, just opened a new line of questioning, but I'm really thinking about how to collect data within our organization to be able to compare it better to the control groups or to the general public, to other comparable groups, and also that we need to advocate on a national level for better data collection, because there is a lot of data being collected and sometimes not in a way where it's able to be used or interpreted in any meaningful way. So then we just collect data for data collection and it's not very, very useful. Yeah, so this is just some new line of thought that we have also like opened in our organization.
Thank you. Yeah, Veronica?
Hi, Shoshana. Thank you for your really interesting presentation as well. And I just want to say that it's so unique that an NGO in Slovakia is doing impact evaluation at such scale as you do. So I'm just wondering, I know we are planning to, of course, share the results quite widely and towards the professional public. But I was just thinking it would be really useful to also share like all these methodological issues and, you know, what you learned, like exactly what you were just sharing with Christina, because I think there is really lack of expertise even how to approach, even if they want to start measuring impact a little bit more sophisticatedly. So yeah, just wanted to share that I think it could really help the sector overall.
Yeah, thanks, Veronica, for that comment. I completely agree. I don't know how and to what extent that will get into the dissemination of the results itself, but it's definitely something that's worth sharing. It's also something open for discussion with Schola Empirica, as they're, I would say, the owner of the methodology, although it was co-created together with our analytical team. But I also see this gap of evaluation and of know-how on how to evaluate or what to evaluate. So yeah, definitely something worth maybe cultivating in our NGO space in Slovakia.
Yeah, totally. Thank you so much. Okay, then if you have any other questions, keep those for the breakout rooms, please. And we can move to the next presentation. Michal, are you here with us?
Yes, hello.
Great. Okay,
Hello,
so
everybody.
Michal will present a project about early childhood development ecosystem mapping and visualization project in Banska Bystrica region. Floor is yours.
Thank you so much. Please let me know if you see my presentation properly.
Yes.
Awesome. So I wanted to share you our journey that we had with mapping this data that we collected and what actually early childhood development tool that we are building is and what can you do with that. And also some similar challenges to previous speakers around data collection and communication with different roles in the project. So yeah, challenges are similar, but let me start with what we had chance to build. So we built a tool that helps you to identify places with high need for early childhood development services. That also might help you create early childhood development strategies and decide where to focus the limited resources that we are having. So we build a dashboard that actually serves two purposes. One is to find what you want, and second is to investigate certain socioeconomical factors against each other, to compare some data that we collected, and enable everyone to just find some interesting correlation in that data. And it also helps to organize the very scattered data that all the organizations might be having and act as a hub for this data, for easier organization and easier access for everybody. So who is it for and who can benefit from it? It's for early childhood development service providers. It's for the government, for regional coordinators, for donors and policymakers, and obviously for teachers and pediatricians that are closest to the kids in need, and also kids and their parents themselves, and many more. So we are still exploring who might benefit from it, and we will try to answer those questions. So what can you do and what questions you might answer with this tool? I want to just give you general inspiration for what can be done, because we are still exploring the ways of what can be done with that and what data we should collect to what will be the most useful thing for all of you. So I tried to answer to place some questions that we might answer using tool, just spark imagination around what more can be done. So for example, what school will be the best for this kid, where to build a new kindergarten, where to run a program, how many kids are there per one pediatrician in certain area, how many kindergartens per kid, is there a correlation between household income and grade repetition rate, for example? Or last but not the least, how do I know what they need? And I will come back to that later. So those questions can be answered using this tool, where I will show you the prototype in a second. Maybe, okay, can you see it now?
Yes, we see the map.
Cool. So, so this is how I will show you how it works. Basically, there are two tabs, two tools. One helps you find one particular service based on certain set of filters. You can find it by name, or you can find it by a service type. Basically, a Google Maps for Banska Bystrica childhood development services. And you can see where is that, what are the contact information, what do they do. And we also, what we want to enable is to not make it only one-sided from top to bottom, but also utilize the bottom to top approach. So everyone, all the services, all the people can post their needs and serve as a way of communication with municipalities, because you cannot, if you look on general data from like zoomed out level, you don't really see the real reasons of the small problems. So we want to connect those two worlds, top bottom and bottom top. And what can you do here? You can filter this map by your either municipalities, service types, field service for kindergarten, special kindergartens, whatever you want to find based on the also kids' age, yeah, main activity, and if that certain location is part of some special program. And this way you can find exactly the thing given kid, given particular case might need. And there is another part, which is investigate part, that helps you compare the data against each other to find interesting correlations for you. So let's say we want to map the kindergartens that offer financial support. And as you can see, we see on the map where is the biggest capacity and where is the lowest capacity in the region. And we can dive deeper into details here. And what we see is, like, for example, total kindergarten capacity or total capacity of any other service we select here. Also, we can compare it against some values. Let's say we want to compare kindergartens versus maternity centers to find out where there might be a need to increase the kindergarten capacity. And we are also able to compare this data. Or maybe we want to see if there is correlation between average household income and kindergarten's capacity. That also answers those questions. So we try to build this tool in a very flexible manner without and we didn't want to limit ourselves with assumptions. We wanted rather to create a framework where we can inject any data we need and be able to compare it or help to find it. So yeah, so use for any more things that we currently think we can, and this is where we need your help to help us figure out where are the how would you use it in your practice. So this is where the journey we had. We started with workshops and interviews with all the coordinators, organizations and policymakers. Then we tried to understand the context, use cases, pains, motivations. And based on them, we tried to understand what data actually we collect. Turns out we need a lot and it's messy. So that's the same case that Shoshana had. Currently, we are in prototyping and development phase. And the next phase is actually deployment. So basically giving this tool for everyone's use, going public with it. Yeah, so this is the process of collecting data we had, like collecting initial sets, then cleaning it up and visualizing. And next step is sharing with public. And this is iterative process. We can run it multiple times whenever new data comes in. So yeah, this is where we need you to help build that database. So I'm very curious about your particular use cases. How would you see this tool in practice? And if you could share some data sets so we can just inject them inside the tool, that would be also amazing. Thank you. Very open for questions.
Thank you so much, Mikhail. Yep. Do we have any questions, or what are those questions? Yes, Katarzyna?
Yeah, Michal, thank you very much for that. It looks amazing. I've seen it already, but I'm still amazed. And this kind of map or something similar, we were thinking about the same 2 years ago, but we didn't feel strong enough or capable enough to go for it. But my question is, you mentioned that you need some data sets, and what kind of data you had to use for this region? I mean, it was the municipality who was able to give you all the information and data, or?
So my role in this was designing the tool, and Teresa and Yvette were responsible for the data collecting part, so they can share a little bit more. But basically, we managed to figure out what might be needed and what would be the best case scenario. So we listed all the needs and all this potential services that might be useful. And then we tried to figure out what is actually doable, obtainable, and what can we even get. So then there was a tedious process where Teresa and Yvette made huge work here to just figure out what can we use for start. What do we currently have? And then we needed to clean it up so it would look the same, just basically unifying that data together. So for example, if we have creeps, we need to have all the basic data, where is it, and so on and so forth. What is a target group? How to answer the capacity, right? What the capacity of kindergartens really mean, because even kindergarten doesn't have this information. And how to unify that. That was all the questions we've had. So what type of data we need? I think we would need to map, answer more questions, how this would be used, and figure out your use cases, so we can add even more and more. Right now, we started with the basics that we had from municipalities and so on. We have two more questions, Shoshana and Veronica. Maybe Shoshana first.
Okay, thanks. Thanks for giving me the option, because then in the breakout room I won't be able to ask. But I wanted to ask, and this question might not be for Michal, but maybe for Teresa, or somebody else. If there would be a possibility of you in the future sharing the data gaps, what exactly would be useful and was not obtainable, if you could write up a summary.
Yeah, sure, for sure. Now you can see it. We try to visualize it. The things which are colorful are the data which we were able to collect, and the ones which are white so far, it's a gaps. So we are still missing a lot of data, but we will try to visualize in this stage like what we have so far.
Yeah, okay. So
But for
I'll
sure.
reach out to
that's
you to get to it later. So because I
Yeah.
would like to
But
have
this
an
is
overview.
very good point to maybe after we release this, we can add a button, for example, for you to contribute with data too, if you see something is missing, to make it really interactive. Veronica?
Hi, Michal, yes, and the whole team, I agree, it looks really incredible. I didn't quite understood the like your response to data collection. So did I understand correctly that it was mainly some databases that are just available or were provided by the municipality, and then plus you were doing some, like Teresa and the rest of the team was doing like direct research, so contacting, for example, those groups, primary schools, pre-primary schools, and so on, or did you just use the data that are already available somewhere in some other databases? And my other question was, like you mentioned that you have some user cases from the municipality. So I was just wondering, yeah, like has municipality of the Banská Bystrica regional self-government started to use this data, and if so, how, or are they planning to?
Teresa, can you help me with the first question?
Yes, sure. About the data, where they are coming from. So most of the data we got from BBSK directly, that they contacted the another offices and collected the data. But also when we did that, like research and the questions and the possible outcomes or possible personas and possible usage of the final outcome, they were saying and actually complaining that all of those data are on million sources, that they always have to look for them and it's not on the one place. So then we shift a little bit also our focus, and we were mostly focusing on the data coming from them, because they said that it's already a huge help when we just put those data on the one spot. That's the one part. The other are, yeah, we did some like basic online research looking for services or service providers which aren't provided by the municipality, but which are private. And then the third group would be that we created something like we want to try the snowball research method, that we will share the sheet with the NGOs and we will try to collect data that everyone can fulfill the maps. I hope it answers the question.
And for the second question, whether they use it already, no, because it's still in development. We are aiming to, I don't know, maybe end of September to have first working version of that. Right now, this is how it looks like today. So we are almost there. It starts to work. This is a functioning version where you can click through. So if team agrees, we might share it with you also for very early testing phase. But how we get the user personas, it was by collecting it from all the yeah, we just conducted several interviews with people from BBSK office and so on. So that's how we try to get initial understanding what they might need and what data they might look for.
Yeah, I would give space for Vlado, as he's going to be in the different breakout rooms, and then we can continue with the questions in the breakout rooms. So Adri,
Sure.
just remember your question, and Vlado, it's your turn.
Yeah, and I think Miroslav also had the questions. Feel invited.
Okay, thank you for presentation. It looks very great. I'd like to ask Michal, of course, when the whole mapping will be finalized and the project will finish, who will be the owner of this, let's say, very sophisticated tool? BBSK? It belongs to BBSK, or you will be, or Hollis will be the owner? How's the agreement between you?
I don't know really just yet. I think we haven't figured it out but we have it on a. We have some general idea because there need to be. It will be hosted on Tableau, which is a tool that we use for data visualization. But then we need to figure out who will be administrator of the data and who will be keeping this actually up to date. So those are very important factors that we need to consider when we will be deploying this thing, and also who will be moderating the communication after we add some forms there. So that's the open question. In my head, I see it as a long-term project where we can keep adding more features, but that would require funding, of course. So I think that's still not answered question.
Yeah, if I can add to it, the idea is that it's gonna be owned by BBSK because they are like a client in it, but it will have many stages, as Michal said. So in the first stage, we are working only with the data which we got from them and collected by ourselves, but I guess in the next stages, it's gonna be more developed.
Yeah,
Okay.
and also this can be, just to add to finishing sentence, this can be deployed anywhere. because like this is like a software package, right? So it's a tool for visualizing things. So if you inject data into it, it will just display this data. So right now that might be used by BBSK, and later that might be deployed anywhere else for any other use case.
Yes, thank you so much, Michal.
Thank you.
Miroslav, can you wait with your question till the breakout room? Thank you. Great. Okay, then we will move on to the last presentation about the very interesting project of coordinated services of early childhood development in one specific region of Banská Bystrica region, and Vlado Maciej is going to present us that project.
Okay, thank you for the possibility to share this project. I think that my colleague Lubica is not present, but hopefully I will be able to share with some updated information till now. So our project is that coordinated ECD in the Jelšava region, and it started in May. Probably first question why we choose Jelšava. It's a small town between the Slovak forest, and it's a very deprived rural region with high proportion of Roma inhabitants, and it's also a region with environmental burdens from the past. You can see this is the magnesit mine with chimney, and its pollution are quite high in this region, and also the communication and the access of any services or any public services are quite limited. But on the other side, there is existence of local stakeholders providing early childhood services, and as well we have very good cooperation with the self-government office in Banská Bystrica, which is also partner of this project. So we evaluated several possibilities where to place the project, and after agreement between all partners, we agreed to Jelšava. And why coordination? We are strongly convinced that through connecting, networking, and better coordination of the stakeholders, we will be able to open doors for easier social inclusion children in the school environment. And this is the YMCA building placed in Jelšava, and we are opening the doors as possible future hope for better inclusion. So in the Jelšava, we make partnership with YMCA organization, which is direct delivery of the service, this coordination service, and it's a well-based organization and well-known in the region. They started 15 years ago and own activities in the Roma minority, with the Roma minority, and nowadays they are opening some new service for young mothers. It's a group sessions providing in this building as well. They are expanding services on the special social counseling and social rehabilitation in the place. But of course, as I mentioned, we are not alone there. There are many stakeholders who are active in the ECD, starting with the pediatricians and gynecologists. There are health assistants with health regions organization Omamas from Cesta, field social worker, low threshold center Jordan, community centers, early intervention center Hnušťa, local governments, kindergartens, elementary school, special school in Jelšava. All these are the actors and stakeholders in the ECD. But you can see the real picture of those who are active. But what is many times missing, that all the stakeholders are working on the online activities, and there is very rare real networking and cooperation. So what we are trying to do last couple months, we connected all the stakeholders and mapping their activities and trying to find the real cooperation for the very specific families who are there, and with this delays, with developmental delays with children, or if the children are disabled. What we are very glad and happy that we found excellent, competent local person, which is Lubica. He works as a early childhood interventionist the last 10 years in Hnušťa, and she was able and willing to join our project. So she started in May this year. But of course, as other projects commented, there are a lot of emerging challenges. And one is that we got the feedback from the local people. We are doing our job. We don't need coordination. So this is this is very often attitudes. What is also present, that social services in early childhood are voluntary. It means that family must show interest in them. I think that Omama have quite good experience in it, that it's sometimes very hard to find families who are willing to cooperate on the side of Roma communities. And each resort provides services and programs along its own trajectory, and sometimes it's unbelievable how it's difficult to break this practice. But when the professionals understand the importance of coordination and cooperation, we see the first reactions as an aha effect occurs, that the local stakeholders have chance to be more effective. Let's give you one example. There was a family with a child in the age of 3 years, and the child was disabled, physically disabled, and he needs to new trolley because he was 3 years old, and the local health assistant, she was very active, and she made the special money collection for the mom, and after 2 months they were able to buy new trolley. But there is a procedure that if you contact pediatrician, and if you ask to prescribe trolley from the public health insurance, you get it free of charge. So then it's sometimes really necessary just to know the information. What's the procedure? What's the role of pediatrician? What's the role of a health assistant? And the action towards family can be more effective and clear. So what's the long-term goal? We believe that every family with a child in early age with developmental delays will receive adequate support in order to reach the child's greatest potential. Thank you for your attention.
Thank you, Vlado, so much. I love the photos. I already told you. They are great. Okay, do we have one question for Vlado? No. Okay, then I'll ask Christina to describe the breakout rooms. We will create 2 rooms and you can then go deeper in those. We are little bit behind the time, so we will have like 10 to 15 minutes in those.
Hi, everyone. So there are going to be 2 options for we decided to split into 2 different rooms. So there's one option will be Socia and Cesta together, and the other one will be Platforma and Hollis or with Michal. So you should see, I'm going to open them now, and you should be able to make a choice about which you want to join. And if you have any issues, just ping me. I'm here. Or if you want me to assign you to a room, you can just stay in this main room and we'll assign you. Welcome back, everyone. Thank you for joining us in those breakout rooms. Some great discussion that we had. We wanted to do a quick announcement about our inaugural conference this year in Prague on November 14th. That will be in collaboration with Hollis and our program partners. This conference is going to focus on a critical issue for our region, early childhood development, education, and care. And our aim is to bring together ECD experts, policymakers, and decision makers to collaborate, plan, and discuss some of the compelling reasons for working together and investing in ECD. More information about the Places to Grow conference is on our website, and we'll put that in the chat. And if you're interested in joining us, don't miss the early bird offer that will end on September 30th. And over to you, Teresa.
Okay, thank you so much, everyone. It was such a nice event. Thank you so much for your time, for your very interesting questions, all of them. We were a little bit behind the time, so I was trying to fit into the time schedule. So see you soon, hopefully on our next online collecting learning event or even offline in Prague on our conference. Have a great day. Bye.